اتفضلي دكتور أمل.
Okay, good afternoon, everybody. Happy to be with you. Uh, my name is Amal Hashish. I'm professor of pediatric surgery, and welcome to the scholarship module. So this day we are going to cover many of the aspects in the research part, and we are going to talk about the art and science of scientific research. So we are going to start from having an idea till you are going to publish your article. So we are going to cover everything in this journey. So we have to ask why this session is important, because actually we are, as a healthcare provider, we're supposed to be educators and clinicians, and research is a very important part in our job. So we have to confess that medical education actually is through its education research. This part will be classified into two sessions. The first session will be today, inshallah, and we are going to revise, update, and upgrade our knowledge about everything research. And in the session number 2, which is going to be the next Wednesday, we are going to talk about the art and science of writing research manuscript, and we will cover it from A to Z, having the title till to write the reference, and we will highlight how to use artificial intelligence in every step in doing your research. So as regard today's agenda, we are going to talk about the research in general, and we will define the research question, and we will revise the different types of study designs as qualitative, the quantitative, and the mixed type of research. And we are going to highlight the points of strengths and weakness in each type. We will know what are the data collection tools for everyone, and we will also highlight the different tools that can help you in research. So let us start our journey. And in this journey, we are going to have many stations. So we are going to cover every station. So at first, we have to define again what is a research. And as you all know, research is a static collection, analysis, and interpretation of data in order to answer a certain question, or to solve a certain problem, or even to put a new hypothesis. So I want you to remember what are the steps of doing research. Can you help me in remembering what are the steps in doing research?
Getting the idea first, for sure.
Yes, right. We are going to have an idea, and then after that, we have
the hypothesis.
To highlight the hypothesis. Sometimes we can do that, and sometimes we don't have any hypothesis. So what is the very next step to having an idea?
Gap analysis.
Research question. You can have a research question.
You can write your research question, yes. So before writing the research, you have to decide what is the gap analysis. So the gap is the part that you are going, this is your starting point to do your research. So you define the gap analysis, and based on that, you are going to move to the next step, which is defining a research question or formulating a research question. Then after you're going to do after writing your research question.
Yes, doctor. After that, we will be understanding our design of study. Which design we want to incorporate in our study.
I think
You
we
have
have
to
to
decide
do
which
review
study
article.
design.
Yes.
Yes, please, doctor.
Which
I think we
was
have to do
the study
article.
design.
Yes, you are going to decide which type of study design you are going to use. And then we are going to move from study design. What are you going to do after that?
We have to make our Gantt chart, what planning we will do, and what are the steps we will be following, with which outcomes we'll be choosing. And then based on that, we will design our protocol. or the procedure?
Okay, so you will have an action plan, and action plan sometimes you need to do it in a form of a Gantt chart, and sometimes you have to put it just in writing. You don't have to put a Gantt chart. But anyway, getting it in a Gantt chart is a very important issue, and it's very deciding what you are going to do in the future. After deciding that, you have to know what are the types of that you are going to collect. Are you going to collect data from patients, or you're going to have patient files, for example? You are going to do or to do an experimental study. So you have to decide which type of study you are going to do and what type of data collection tool you are going to use. And after that, after collecting the data, you are moving to the next step, which is analysis of the data. And then the last step is to write your research article. And writing your research article, we are going to elaborate on it more on the next session. So these are the steps of doing research. So let us revise it in. We'll start from having an idea, and then formulation of the research question, then choose research design, then carry out data collection, and then data analysis, and then writing your manuscript, and then dissemination in the form of publication of your research, in the form of presentation in a conference, or in a publication in a journal, kind of journal, international or not, or whatever. So starting from having an idea, we have to define from where shall I get my idea. It's from reading literature, or from careful observation of people, or keeping an imagination roaming, or from previous experience of my own or my colleagues' experience, or from scientific communication, or from my mentor, or whatever. So this is the way how to find an idea. But sometimes we don't have any idea, and I can't find any place or any source of having idea. So in this way, we can use artificial intelligence, and it is okay to get access to any one of the artificial intelligence tool in order to help you to write the idea. We just write a good prompt, and then after writing the good prompt for whatever tool you are going to choose, either ChatGPT, Gemini, Research Rabbit, Perplexity, whatever, you will have multiple ideas generated, and you can choose whatever suitable for you. So there are many tools for the AI, and we are going to talk about them in this session and in the following session. So we are having many tools for AI, and we can use any one of them in order to generate an idea in whatever aspect we want. My advice is to look for a very wide idea, because it will help you to have more information about many subjects. So you are going to have an idea, select a broad topic, and then after that, you have to read about this topic. Let us give what is the example of broad topic. Like, for example, the effect of social media on people, or evaluation of the new teaching on acquisition of knowledge by students. This is a very broad topic and very generic topic. You can read in this topic in order to have a certain point or a focused point that you are going to do your research in. Why we are advised to have a broad topic? Because this will help you to read more and to know the update in this topic. So after that, we have to focus this topic into one idea that I'm going to do my research in. So we are having an idea, and then the next step is to have what is called literature review or the literature search. So we have to read everything about the topic. We have to read as much as we can. We have to read the all topics. We have to read the most updated and recent topics or literature. We have to read all the relevant papers, and we have to focus on the most influential paper or article in this topic. So this part is very important. As we said before, in the residential session, we have many areas in order to read in it. We have the primary literature, the secondary literature, the tertiary literature, or even the gray literature. Primary literature are the topics, the articles that is in many journals. The secondary literature is important also to read because it is collecting many articles with each other. This is an example of it is the systematic review and meta-analysis. The tertiary literature like the books and the encyclopedias, and the gray literature like, for example, the patient files is not published. So we have to read everything in order to know what are the knowledge that we are going to gain. This part is called the literature search. So literature search is a process of searching for information related to the research topic across multiple databases and information resources. So what are the databases and information resources? We have the hand search, for example, writing books or writing papers or writing gray literature, as we said, reports or patient files or whatever. And also, we can have the electronic search. We're going to do a research in the medical field. We have what is called the search engines, like the Midline, the Cochrane Library, like the National Library of Health, many places that you can find whatever you want. This is all for the medical search. So in order to search for medical subject, we can look for the words in the text words or the abstract or title. You can use what is called the mesh. The mesh, which is abbreviation of the medical subject head. What is that? It is the National Library of Medicine. They are making a dictionary for the medical terminology in what is called in order to facilitate finding the articles. Also, we can use what is called the Boolean logic. Boolean logic is one of the algebra words we can use, for example, and or not. Yes.
May I add something?
Yes.
Yes, a mesh is very crucial when you pick your keywords for your research. Because if
can you speak up, please? Can you speak up a little bit, please?
Can you hear me right now?
Okay.
Yes.
Yes, please.
Mesh is very crucial. Mesh is very crucial when you pick keywords for your research. Because when you pick keywords matching the mesh, your research will be like searched well or will be chosen well. So when you choose the keywords for your research, you should go to mesh and pick the keywords which matching the keywords in mesh. Thank you.
You can use a mesh for right, and also you can use a mesh for subjects. So if you want to search for subject, you can use a mesh also, because sometimes you need to have a certain, for example, if you use for the kidney disease, you can use also the renal disease. So they have many items or many names for one subject. So it will help you for search for literature, and it also will help you to find the keywords that you are going to put in abstract at the end of your abstract in order to publish the paper. So you can use it in two situations. Also, you can use the Boolean operator, and the Boolean operator is how to search for subjects. For example, if you can use, for example, hernia and child. If I'm going to have a research about hernia, if I write like hernia in the searching engine, it will give me everything about in the children or in the adult or in the adolescent. But if I am going to specify that I want it in the children, so I will write hernia and child. Or for example, if I want to write, for example, assessment, if I write assessment, it will give me many methods of assessment. If I write assessment and postgraduate, or if I write assessment, for example, the workplace-based assessment and postgraduate, it will be more concise search. So it will help me to find a more concise places to find my research in, whatever I want to read. Also, I can use the or not. These are algebra part help you to find your research. These are general terms. So actually, literature search is a very complex part. And it is a very difficult task, and it is a very challenging part in doing research, because you have to find the paper that you want to read, you have to read it, you have to evaluate it, and you have to analyze these topics. What is analyzing is to do critical appraisal, is to highlight quality, is to do quality assessment of the papers that you are going to read in order to have a good idea. And for example, there are many places or many tools that can help you to test the quality of the paper that you read. For example, we have the JADAD score and many other scores. We have the Prisma. We have many things in order to evaluate or to critically appraise the paper. But actually, in general, I find that reading is very important in order to understand the current status and to justify your research idea, define the research question, and to highlight the research gap, and to avoid redundancy, and to select the appropriate methodology. But as I told you, it is in order to find a gap in literature is very difficult. Research gap, you have to find the area which is go unexplained, area which is unanswered, or any new point or whatever has been done before and the other researcher didn't find a solution for a problem. So you have to start with this research gap. So let us go again and to know how to focus my part. For example, if I am searching for plant abdominal trauma, which is a very broad subject, I can make it more concise by, for example, searching for the CT scan for the plant abdominal trauma, or having any score for diagnosis of plant abdominal trauma, etc. So we start with a big idea, and then reading will help us to focus our idea in order to start our research. And as I told you, literature search is the most difficult and most time-consuming and most challenging part or step in doing your research. Why? Because we have many articles. There are thousands and millions of articles. You can find it, and you cannot read it all. So what is the solution? The solution, I find that artificial intelligence, and this is the most important part that I find it, that artificial intelligence can help in doing our. It can help you access to a various academic literature. So what tools that you can use to do that? You can use the lit maps, and lit maps is giving you a map for many literatures. For example, if you upload one of these of whatever article that you like, and it will give you a map like that. This map will tell you what are the related articles that you are interested in. So you can move through these articles and you can read whatever you want, and you can ask questions, and you can ask it to summarize whatever you want. We have also the connected paper, which is another, also it can give you a good map to find whatever article you want to find. Also, we have the Research Rabbit. Research Rabbit, you can upload the keywords of your research, or the DOI of your research, or the title, or whatever, and it will give you also a map, and it will help you to have your own library. So in this new collection part, it will help you to make your own library and to put whatever research that you want. It can help you to find the reference of your article, and it can help you to have this map and read whatever you want of these articles. And also it can help you to summarize any of the articles. Also, we have another tool which is very important, is the OpenRead. Also, it can give you, and it is uploaded on it, more than 300 million different articles. Also, OpenRead can give you the map. You can, by using the plus or minus, this plus or minus on the right side of the slide, you can maximize the page, or you can minimize the page. You can read whatever you want, and you can ask also for questions. You can ask, for example, what about this paper? What is the size of this paper? And what is the research design of this paper? And it also can make whatever what is called the paper espresso, which is summarizing whatever paper you want. This is the summary of a paper called paper espresso, summary of a paper that I upload. It summarizes it in one page. Also, we can use a chat doc, and chat doc is using also only the PDF files. So you can drag and drop the PDF file, and you can ask whatever question you to know about the paper. So you can summarize, you can ask questions, you can do whatever you want. Also, we have the explain paper, and the explain paper has the idea of explaining the paper at a different level. For example, if you want to explain it at a professor or a student or whatever, so it can explain paper at a different level. Also, this can explain the chart or can explain the whatever you find I can't understand. Also, we have Elicit. This is one of the good sites also. We have what is called site. This is also on Jenny. So there are many of them. And there are what is paper GPT. This site can give you the best 10 article of whatever you upload for it. So now, to wrap up this part, we are to start our research. We have to have an idea. Ask for idea. If I don't have an idea, I can ask the artificial intelligence by writing a good prompt. And then after having a good idea, I have to read about everything about this idea. And then I have to focus my research into one point. And of course, I can ask for the help of AI in this step. So this is the first step. Then we are going to move to how to write your research question and what is the importance of research question. So at this part, any comment, any questions?
No, clear. Thank you, Doctor.
Thank you, Doctor.
Thank you, Doctor.
So can you remember how to formulate your research question and what are the formats that we are going to do or we are using usually to formulate our research question? And what is the importance of the research question?
Usually in the research question, we are addressing the gap that we came up with.
Yes, you address the gap. Okay. And how to write it? Do we have any facilitate writing our research question? And what is the importance of research question? Okay, so let us move. Actually, research question is very important. I writing research question need a meticulous thinking about how to write it. Why? Because research question will help us to define what is the populations that we are going to work on, and what is the study design, and what is the duration of the research. And actually, we are going to use research question in writing our introduction. We have to highlight the research question in the introduction part of the paper, and in the discussion of the paper, and in the material method part of the paper. That's why it's very important to write a very good and meticulous research question. A research question should be concise and focused and arguable question, which express what is the project aim to address. Or in a simple way, it is a question that you want to answer upon finishing your research. You can write research question in the word what, why, where, and how. For example, this is an example. Does implementation of competency-based education for undergrad medical students at Egyptian universities improve their performance in clinical approach? And we are going, what does implementation, how, which is competency-based education, who are medical students, and where in Egyptian university, etc. But actually, this is sometimes not convenient to write research question in this way. That's why we sometimes use, or we usually use the PICOT or the PICOTs which are using in the evidence-based medicine. So in PICOT, P stands for population, and I stands for intervention, C for the counter intervention, O for the outcome, T for the time frame, and add the S for the study design. So let us have an example. For undergoing an end-round exam in pediatric surgery, does OSCE compared with conventional clinical exam lead to achievement of better score as addressed by randomized control trial? So where is the, can return back to the PICOT. P, where is the P? Population. Who is the population in this study?
Student.
Yes. And again, intervention. What is the intervention?
Introduction with OSCE.
We have OSCE for one group and conventional clinical exam for the other group. And what is the C? This is a OSCE and conventional clinical exam. And what is the O? What is the outcome? The outcome, we will know the score. Are there any difference in their score or not? And what is the time frame? It's not necessary to write everything, but it is an exam. And what is S, the study design? It is a randomized control study. So this is the PICO, population, intervention, comparison, outcome, and study design. So this is how to write a research question in a very professional way. Again, in undergraduate medical student, P, this is the population. How does problem-based learning, I, this is the intervention, compared to traditional lecture-based instruction, and this is the C, the comparison, affect standardized critical, which is the outcome over one semester course, which is the T, it is the time frame. In order to do that, it's very important to have a good research question. So what are the criteria for good research question? It should be finer. So it stands for, it should be feasible, it should be interesting, it should be novel, ethical, and relevant. And what is feasible? Feasible means that you have the material, you have the experience, you have subject or patient or population, you have the money, you have the time to do it. Interesting, it should be, of course, generate new ideas or generate a new fund or getting truth of a matter. Novel should be, of course, novel. It should be a new idea. It should be ethical, and it should be relevant that can help in the scientific, advancing in the scientific knowledge. So this is how to write your research question. And as we said, research question is very important. That's why I have, after writing my research question, I have to evaluate. Evaluate is in terms of what? Is it clear? Is it focused? Is it complex? Is it finer? So I have to revise it. Why? Because research question is going to focus your study. It will determine the methodology, determine the kind of data to be collected, it determines the period of the study, and it guides you at all stages of research. And you are going to write it in the introduction, in the material method, and the discussion. That's why it's very important. So the criteria of bad research question is a bad research question is the vague, too broad, irrelevant, inappropriate, with high costs that you don't have the much money to do with resources and with questionable ethical consideration. Actually, research question, we consider it as a methodological point of departure of any research, and this is the message, the first message of today. The most important part of the research question, it should be researchable, and it should be answerable, and it should establish a scientific method and procedure. Actually, it can be used or can be written by artificial intelligence. If you are going to write a prompt for artificial intelligence, this is my idea. Please help me to write a research question according to PICOT criteria. It will give you a very good research question. So it is very easy now. So artificial intelligence can help us to find the article, can help us in article summarizing, it can help in answering questions, it can explain graphs, and it can help us in formulation of our research question. So at that part, what is the importance of highlighting the gap in literature? Because the gap in literature will guide you to write your research question, because gap in literature means that there is a problem in literatures that is not solved by anybody, or it's solved partially by somebody, or there is theory that is proved by anybody, or we don't have the very important proof, or we have a misunderstanding of the proof, or anything like that. So having a gap in the literature will help us to focus our research, and then will help us start our research and to write our research question. So this is the first step, or actually it is the second step of having my research. So any question, any comment?
Thank you.
Oh, thank you, Doctor. No.
Thank you, Doctor.
So let us move to choosing the research design. Okay, what are the types of research design that we know or use so far? Can you give me idea about whatever research design that you prefer, you did your previous research?
I prefer to get idea from the work, from the real problems, because if even if you have like an interesting topic and you go to the AI, I think if it gives you like options, all these options are not related to your work. Like you said, it may give you like a very broad idea, or idea with no funding capabilities for your level. So I think the idea, when it comes from your work, your real problems that you and your colleagues face every day, I think it's like the difference between dead idea and alive idea. It's alive idea.
Of course, you are very right. If you have an idea, so use the AI. But if you don't have any idea and you want to just to improve your way of thinking, or to have another channel of thinking, so you can have many ideas from the AI. It can help or not help. So you just ask for a friend for help, and that's it. There is no obligation to use the AI. If you have your own idea, it's better than having the AI help.
For sure.
But if you don't have, so it's better to use it. So any
Doctor.
idea about the study designs that you used before?
Doctor, we use quantitative design, we use qualitative, and sometimes mixed method design. It's based on our study. What is our objective and what we want to achieve? So we have
You
these
have the
designs.
quantitative and qualitative, yes,
Yes,
and
and
then
also
what?
mixed method design.
Mix of them. Okay. So use the quantitative. What type of quantitative did you use?
We use descriptive, cross-sectional study, cohort study. We
Yes.
use
Okay.
yes.
And what type of qualitative?
Qualitative study, we have many approaches, ma'am. We have epistemological studies. We have I use one study that it is based on the Brown and Clark guidelines. So mainly that is mixed method design I'm using.
Phenomenology.
Okay.
Phenomenology.
Okay. Thank you. Thank you so much. Any other comment or any other ideas?
Ethnographic studies, phenomenology, grounded theories, all these things.
These are the qualitative studies. These are enumeration of the qualitative studies. And what else?
Yes. Mixed method design involves both, madam.
Mixed method is a mix from the of quantitative and qualitative, one quantitative and one qualitative. What else? Actually, as the study design, this is a very complicated subject, and we have many research methodology types. Actually, research methodology defined, it is the science of studying research is done scientifically. And there are many classes for the study design classification. Some classified into primary and secondary research. Some are classifying them into experimental or non-experimental. We classify them into qualitative, quantitative. That's just a very complicated tree, and we can classify them as like that: fundamental research, exploratory research, descriptive research. This is one classification, but actually the best classification and the most easier one is to classify them into qualitative, quantitative, and four is mixed type of research. And as you know, the quantitative research, we are using numbers. We are using statistical analysis, and we are using computational design, and we are using facts. But in the qualitative, it is just a narration information, like telling a story. This is the idea of the qualitative research. And of course, the quantitative research and qualitative research can be mixed in what is called the mixed type research, and we will highlight on that after time. So as regards the difference between qualitative and quantitative, actually the qualitative research is having a larger number of participants, larger size than quantitative, and qualitative. Because qualitative, we need a very small amount of patient or participants or whatever. Actually, the qualitative research usually follows hypothesis of the quantitative, the hypothesis. As we said, qualitative research is expressed in words, only words. There are no numbers at all. But in quantitative research, is expressed in numbers and percentage and etc. That's why qualitative research is usually subjective. You cannot prove anything. You can just tell a story of something. But in quantitative research, because there are numbers, they are considered as objective research. So that's why qualitative research is not generalizable, but quantitative are generalizable. What is meant by generalizable? That we can apply it for the general population. So I can apply the result for the general population. If I said, for example, this drug is giving a cure rate of 80%, so I can apply it. But if I say this drug is giving a decent cure rate, and I don't have any number, I cannot apply. That's why qualitative research cannot be generalizable, but quantitative research is generalizable. So what are the types of quantitative research that we know? We are classifying them into experimental and observational. And I know many of you are using this research, but sometimes the name is not coming to our mind. So as regards the experimental research, that you are going to do something by your hand. You are going to give medication, you are going to classify the student, you are going to do some tests, whatever. But in observational, you are not going to do that. You are just observing. If you are observing and describing what you observe, it is a descriptive. But if you are observing and you are going to analyze the data, so it is analytical. So quantitative research, we are classifying them into observational, which could be sub-classified into descriptive part and analytical part, and the experimental part in the quantitative research. So let us have some example of that. So observational research, the researcher collects information. If he is going to highlight the information or to write it, just write it, is an observational research. If he do some analytical study, so it is analytical research. But in experimental research, the researcher deliberately influences the event because he is intervening with some medication, with some test, with whatever. We also have to know to measure terms like the prospective study and the retrospective study. So if you are calculating or collecting data from the past and you are going to present it today, it is a retrospective study. If you are going to start from today and you are going to collect data for the future, so it is a prospective study, and we are going to highlight on that after some time. So let us have an idea about the first part of, or the first item of the quantitative research, which we call the case study or case report. Anyone can highlight this part or can give us a definition of what is the case study or case report? And did you do before any case study or case report?
Yes, I got 3 case reports published in like international journals. It's from its name. It's reporting a case, might be novel in itself or in its management, or you developed something novel, or you just report something very rare. If you have many cases, you can make it like case series. But
Okay, many cases like what? How many?
5 cases. If you have to, I think 3 to 5 cases, you can more than 5 or 5 to 10 cases, you can make case series, and it comes in the bottom of the research because case report followed by the hierarchy of other research. So it's
okay. Excellent. So a case report is a case study, or case study is a detailed account of individual case or small group case or event, something abnormal, something that eventually happened, something that you notice which is new, and it's often highlighting rare conditions or phenomena. And actually, it highlights the uncommon situation or uncommon disease or emergent disease or sometimes unexpected event or adverse event or new technique. So this is called case study or case report. They are the same. Some people say, or some researchers say, if they are less than 10 cases, you can say it a case study or case report. Some of them say if up to 5 cases, they are case study or case report. More than that, they are case series. So let us have an agreement. If we have from 1 to 5 cases, they are case study or case report. If they are more than 5, we can consider it a case series. As example of the case study and case series, they are very important actually in history. You know the Hirschsprung disease. Hirschsprung disease is one of the congenital disease, and this name Hirschsprung after the scientist or the doctor who discovered it. He discovered 2 patients with chronic constipation, and they died eventually after treatment. The treatment failed. So he reported that, and at that time, it's not known as the Hirschsprung disease, but after 10 years, people, another researcher or another scientist, they name the Hirschsprung disease after the Dr. Hirschsprung, Herard Hirschsprung, who discovered the cases. That's why this is a case study or case series are very important because they highlight some cases that many other researchers later on will discover and do more research on them. For example, this study, the sarcoma in homosexual men, a report of 8, Kaposi sarcoma, report of 8 cases. These are 8 cases, and this is a case series that was at 1981, and it was the first report of cases of HIV. And again, hemorrhagic fever-like change and normal chest radiograph in a doctor with SARS, and this was the first report about SARS. That's why we are encouraging people to write about case study and case series. So if you see any adverse event or any abnormal case or any abnormal complication or anything like that, you have to report it in a case study or case series because it will open the door for more investigations. Let us give an example in the med education. If you are a researcher or if you are a lecturer and you are teaching, for example, whatever course for some student, and you observe that some of those students, for example, 5 of them are not engaged or they fail the exam or something like that, you can write a report about these students. What is the condition? Why all students are succeeding and these 5 students are failing the exam? So you can write it like that. This is a naive example, but you can write it like that. This is a case study. If they are more than 5, of course, we consider it a case series. So these are how to do a case study and case series. And as we said, they are opening the door and highlighting condition or phenomena, and it opens the door for more researchers to do research in this subject. Maybe one day it will be, they can raise a theory or something like that. So these are the case study or case series. What about the cross-sectional study? Any experience in cross-sectional study?
Cross-sectional study is like a snapshot in a specific time to collect information at this time.
Yes, we are collecting information at a certain time. For how many times we're collecting information?
Once.
Yes,
At
we are
point of
collecting
time.
information only one certain time. So the cross-sectional study is an observational study. It's not experimental, just observational study, in which the event and outcome data are collected at essentially the same time. For example, if you are doing a workshop, for example, and you have immediate feedback from the trainees during those who are attending this training work, you are collecting the feedback at only one time, at single. This is why it's called a snapshot, and this is a cross-sectional. So the study is relatively a study, and it is inexpensive. Weak study. It is not a very strong study like the experimental study, but it is easy to do and it is easy to write. So we have, on the other hand, what is called the longitudinal study. Longitudinal are having data at very different parts. For example, when the cases are closely followed up for recording the event at different point of time, it is called the longitudinal study. If you are following the report of patient or following the degrees of student among time, this is called a longitudinal study. So the difference between cross-sectional study is the cross-sectional study, we have only observation at one time. But in the longitudinal study, we have observation at more, at different times or locations or something like that. So you are following the student among time. So if you are going to evaluate the score of student at one time, this is called a cross-sectional study. For example, you are going to do a graph about the level of student at the end round. This is one time. If you are going to follow the student all over the year and to have the final score and to follow them continuously all over the year, every month or every 2 months, etc. So this is a longitudinal study. So score to measure if the score is changing over time. So this is the difference between the cross-sectional study, which is the data collected at one point in time, and longitudinal study, data collected repeatedly over times. So now we cover the descriptive part of the observational study.
Professor
Yes?
Amal, can I ask a question regarding the cross-sectional study? I came across the concept that whenever the cross-sectional study deals with association of variables and correlation between variables, dependent and independent variables, one can call them analytical cross-sectional study. What's your opinion about this concept, please? Thanks a lot.
Yes, you can do that. That's why if you look at this slide, you can find the cross-sectional study is written one time as a descriptive and written again another time as the analytical. Can you see the slide? Can you see this classification? So cross-sectional study is written one time as a descriptive, and it is repeated again as the analytical. So if you are going to just report whatever you find without analysis, it will be a descriptive cross-sectional study. If you analyze the data, it will be analytical cross-sectional study. So you are very right. Okay. Any question so far?
No, thank you.
Okay, so now let us move to the analytical part, which are we have the cohort study and the case control study. So let us start with the case control studies. Usually we have many problems with the case control study because sometimes it is difficult to be done. So what is the definition of case control study? In order to have a case control study, you start with the people who have a problem and then match them with control that do not have a problem. But we have to have one condition, that all these population should be facing the same environment. And then you have to look back and assess the exposure that they have in the past. Again, let us make it more simple. For example, we have this population. We have many populations, say, let us say if they are students in a class. So we have some students in this class, they fail the exam. So we are going to recruit these students who failed the exam, okay? And these are the cases. And we are going to recruit another group of students from the same class who are having the same study and same environment, but they pass the exam. And we are going to look backward to see what are the causes that make these students fail the exam. So now the key is that all the study sample and the control sample are exposed to the same environment. And we are looking backward to know what happened to make this student fail the exam and the other student didn't fail or succeed the exam. So in another word, if we imagine that this circle is a factory, for example, is a factory for whatever, for chemicals or whatever. And I found when I'm doing checkup for the workers in the factory that 10 of these workers develop lung cancer, for example. So I will recruit them as a study group, and I will take another 10 workers who don't have any lung cancer, but they have to be comparable. For example, if the groups that are smoker, that are having a lung cancer are smoker, those groups which are controlled should be smokers also. If they are at a certain age, we have to have these groups of control at the same age. So we are recruiting the sample size, which are the workers who have the cancer lung. And we are recruiting another group, the control, which are comparable group without cancer lung. And we are looking backward to see the environment that they were exposed to. Is the cancer that developed in these 10 workers is due to the environment of the factory or due to another factors? Is it clear?
Yes.
Yes.
Any more elaboration?
Yes, if you please.
Regarding the number of the control compared to the case, what do you suggest? They have to be of equal number, or you suggest that the control over numbering?
It is better to be equal number, but sometimes it's not necessary to have. It is better to have it equal. Sometimes it is not necessary to have it even number. You can have it different number, but not too much numbers. For example, you can have a difference from 5 to 10%, not more than that. For example, if you have the worker in this factory, for example, 500, and the patient, the worker who developed lung cancer, they are 10. You can take the control group up to 15. Okay? 15, maybe 20, but 15 is the best. 15, 18, or 10, which is okay. To take it 10, it's okay. So, but you don't need to take a very big number. Okay?
Prof, can I ask one question?
Pardon me? Yes?
Can I ask? Yeah,
Yes,
Prof,
please. Yes.
for case control study, if we have the two types of cohorts with us, one is with lung, both have lung cancer, or but Prof, if there are confounding factors, for example, if one group has a low immunity, so they will definitely develop, I think, cancer more easily than the ones who have good immunity.
Yes, that's
So
why
in
you
this,
are
how
looking.
to, yes,
Yeah,
Prof.
Yeah, that's why you are looking backward. You are investigating those patients. Are they having any extra factors that predispose to have lung cancer, or the lung cancer developed because of their exposure in the factory? That's why you are studying them. You are studying them totally for everything, for their lifestyle, for their time they spend in the factory, for their exposure to another environment, for their living place, anything like that, for their genomic map, for example, for their healthy lifestyle, if they are smoker or not, as we said, if they are very old or not, if they are taking another sorry, medication or not. So you have to revise everything in order to know if working in this factory is a cause of having lung cancer or it is due to another causes. Okay,
Yes, yes, Prof. Thank
so let us move. So this is the case control study, and let us have a real example. So resident in difficulty, it's written like that. Just slower learner, a case control study. What do you think they did in this study? They have, for example, the study was done on 80 on a group of students of residents, about 500 residents. So they found that there are 89 residents. They have difficulty in training, difficulty in their performance, everything. Though they are working at the same hospital and they are having the same shift and they are having the same environment, everything. So they try to compare them. They recruit these 89 residents and they compare them to another group of residents who don't have any difficulty in their life. So they look backward for the residency time. Of course, they have to be at the same time. For example, if he's a resident for 1 year, they recruit residents who are spending 1 year, for example. If he is in the surgery department, he should use the control of the surgery department. And they are looking backward to see what is the problem of this resident, why their performance is not up to the standard. Is there any personal factor, or the problem in the environment, or in the problem in their personality, or in the problem in their superiors? So they are doing that in order to know why these residents are in difficulty. This is a real case. This is a real study, and it was published in the BMC, Medical Education. So let us have another example in education also. If you are a lecturer and you are doing some lectures in whatever statistics or anything, and you find that some of the students are of low score. So you are going to recruit these students and you are going to choose some group of students who are not, who are performing good. They are in the same class, and you are comparing the history of these students, if there are any other factors that affecting the low performance of these students. So this is how to do a case control study. So the researcher compared the two groups to see if a specific past activity or characteristic was more common in one group than the other group. Again, we have an exam. We have group failed the exam. These are the cases. And then we are recruiting another group of students who pass the exam, and we are comparing the two groups as regards the past history, what happened in the class that makes these students fail the exam. So this is in photo how to do the case control study. So this case control study is under the category of the analytical studies, of the observational study, of the quantitative study. So what is the following one is a cohort study. So far, any questions?
No.
Any questions? Any experience in case control study? Okay, let us move to the cohort study. So I want anybody to
Dr.
share
Amar,
his experience. Yes,
may I add something?
yes,
Sorry.
please.
Yes, there is like an exit point for some colleagues who have like interesting case reports, but when he validated or she validate the case report, he or she or they found it published before. You can publish it with make it case report with literature review. So if you shouldn't be disappointed, you can make it. You can publish your case report, which is very interesting and it's something novel, but it was reported before by making either case report or case series, like you increase the number of cases rather than who published it before, or make case report with literature review. At this point, it will get published. Thank you.
Yes, of course, I agree with you. Because if you have a case, it is not necessary to have the only case in the world. You can have the case and you publish it, and you can have what is called a case. We usually say it like that: a case report with literature review, which means that you have your own case or two cases or three cases, and then you do a literature review to see what other people or what other researchers all over the world did about that. So you may be not the first one that publish a case like that, but you are augmenting the data all over the scientific data all over the world, and you are sharing your experience with the other researchers. So it's meant that if you find that somebody published a case report and you have the same case, it is necessarily to publish it again. To publish it with having the opinion of the other researchers that publish their cases again. And it is very important in order to share information with the other key player in the field. So what about the cohort study? Any opinion or any experience in cohort study?
Yes, Prof. We have two types of cohort studies where we observe the participants over a period of time. Either we go backward or we go forward, Prof.
Yes, you are right. So we have cohort study, we can do it in a retrospective or prospective cohort study. So what is cohort study? Is a following one group of people over time, or following two group of people over time, or following 5 group of people over time. That's why it's called cohort. Cohort, which means like a group. So you are following group of people or cohort of people over time. You can have only one, your study can be on only one cohort, or 2 cohorts, or 3 cohorts, or 10 cohorts, whatever. But you are going to follow them. You are not going to intervene. This is an observational study, but it is an analytical study. You are going to follow them and then analyze the data that you have. That's why we have the retrospective cohort and prospective cohort. So if I'm collecting data from the past and I'm going to report it today, it's called a retrospective cohort. If I'm going to follow some group of students or patients for the future, it is a prospective cohort. So, and actually, a cohort study is one of the longitudinal study because you are following the patient or the student for many times, for a frequent part of times. So cohort is followed over an extended period of time to study and to track outcome. And actually, it is related to the exposure. So as regards how to do the cohort, you have to select the sample of population, and you have to measure the predictor or variable, and then you have to follow the cohort, and then to measure the outcome. This is the prospective cohort. Or you can collect the data from the past, and you can report it, and this is a retrospective cohort. So following 1,000 healthy nurses for 10 years to see if high caffeine intake leads to hypertension is a retrospective cohort or a prospective cohort. What do you think?
Prospective, because I'm gonna
Prospective
follow.
cohort.
It's according to when you are going to follow them. If you are going to follow them for the following 10 years, it will be prospective cohort. If you followed them and you are going to report the data today, if you followed them for 10 years previously, and you are going to follow them today to report what did you find, how many of them develop hypertension, and how many of them develop cardiac problem, etc. So this is a retrospective cohort. So you can define the time that you are going to follow your cases according to the time of following. So you can have one cohort following the children, for example, who are eating fast food. If we are going to follow the children who are eating mainly fast food for 1 year from now, it is 1 year from now for the future. It is
Prospective.
But if you have the report in the clinic of obesity, for example, if you have the report and you are sitting in the clinic of obesity and you have the files, if you have a files of children who are eating fast food and you are going to evaluate the body mass index today and you are following them backward for 1 year back, so it is a retrospective cohort. If you are going to follow group of people who are eating vegetables, for example, or healthy food for 2 years, and you are going to follow another cohort who are eating fast food or unhealthy food for 1 year, so this is a prospective cohort, and these are 2 cohorts. So you can have 1 cohort, 2 cohorts, etc.
So what about the ethical dilemma surrounding the prospective cohort?
Can you speak up, please, because your voice.
What about the ethical dilemma surrounding the prospective cohort?
Ethical dilemma as regard what? You are not going to intervene in anything. You are just following the patient or following them in your clinic.
They are exposed to a risk that carries a potentiality to have a disease. For example, if I'm following a smoker who are likely to develop lung cancer prospectively, for example.
But you are not offering them the food. They are eating their food. For example, people who are eating vegetables or vegetarian, we are following them as regards the body mass index or this whatever blood pressure or any investigations, and other group of people are eating whatever they want, and we are following them. There is nothing unethical in this. We are not offering the food. The problem will be ethical if we are offering medication, and we are going to talk about that later on. So you are not intervening in anything. You are just observing them. If you want to advise them, this is another issue, but we are going to observe them. So you are not intervening in anything.
Dr. Hala, is case control study is a retrospective study? Because some of our colleagues, they said they already have the disease, they already have the risk factor. It is a retrospective.
We don't write retrospective or prospective in case control study. It is written by its name. It is a case control study. So we don't put retrospective or prospective.
But if we need to add it,
you don't need to add it. You don't need it. It is explaining by itself. It stands by itself. You don't need to write a retrospective or prospective. Anybody who is expert, you know that that case control study, we are collecting data from the past, but you don't need to write it is a retrospective. No need.
Is it retrospective or prospective?
You are collecting data from the past, but you are reporting them now. It is retrospective, but you don't need to write it.
Okay, thank you.
Okay. So now again, if we are going to have this cohort, so you are collecting score of students over time. For example, I'm collecting them after the first month, the second month, the third month, etc. So this is called longitudinal cohort study, which are collecting data, observational data from one group of students over time. So we can say longitudinal cohort study, which is very right, but we don't need to write it is a retrospective case control study because it is known by itself. So if you write a longitudinal cohort study, is a very respected item, and we don't have any problem in that. If you are following 2 groups of students, some of them are attending, for example, the morning class, and the other group are attending the afternoon class, and these are 2 cohorts. So you are following them and you are collecting their score, and you are just observing them, but you are analyzing their marks. So this is called an analytical longitudinal cohort study. Is done for two group of participants. Okay, so this is the cohort study. So to wrap up this part, we know now what is the quantitative research. We have two major categories, the observational one and the experimental one. As regards the observational one, we have two more subcategories. We have the descriptive, and we can find in it the case study or case report, which is a study, observation, reporting of cases less than 5, or situation less than 5, or adverse event less than 5. If it is more than that, it is called the case series. And we have the cross-sectional study, which collecting data at a single time, and you are just observing and reporting. So now we'll shift to the other category, which is the analytical category. We have in it the cohort study, which is following group of participants, one cohort, or two groups of participants, which is two cohorts, or more than 3 groups of participants for certain time. If you are going to follow them for the future, it will be called a prospective cohort. If you followed them in the past and you are going to report it today, so it is a retrospective cohort. We have the case control study, in which we are recruiting group of population who are having some problem or some situation, and we are comparing them to another group of population. But the condition here is that those two groups are exposed initially to the same environment, and we are looking backward to see what was the problem in the exposure previously. We have also in this category the cross-sectional study, which is the analytical one. So if I am just describing a group of population or student, it could be descriptive, it could be cross-sectional. If I'm going to analyze that, it is called cross-sectional. That's why cross-sectional is written one time in the descriptive part and written another time in the analytical part. So any question?
No, clear.
So now we are going to move to the experimental design, which is very important part. And experimental design is a detailed plan. It contains a set of procedures for collecting and using data to investigate the causal relationship between variables. Now we have to define what is variable. We have two main types of variables, the independent variable and the dependent variable. So what does that mean? So let us see it in a photo. In this photo, we have a plant and we are watering the plant. So we consider now that the plant is a dependent variable. Who is the independent variable? Is the water. The water, we are watering the plant with water, so it is the water here is a independent variable. But the plant depending on the water, that's why it is called the dependent variable. Let us make it more easier. This is a patient and he's taking medication. The patient is dependent on the medication. So that's why he's called the dependent variable. The medication is not dependent on anything. That's why we called it the medication is independent variable. So in these studies, in the experimental studies, we are studying the effect of the independent variable on the dependent variable. Is it clear? Is it clear?
Yes, perfectly.
Okay, so in experimental study, we are studying the effect of something on another thing. The first thing is what is called the independent. The second is the dependent. So we are studying the effect of the independent on the dependent. For example, the students are dependent variable because they are depending on the teaching. The teaching methods are independent. The students are dependent because we can teach them in classes, we can teach them outside the class, we can teach them problem-based, we can teach them traditional, whatever. So these methods of teaching are independent. But who depend on these methods are the students. So now if you are going to study the effect of different teaching methodology on the student acquisition of knowledge, who is the dependent? The student. Who is the independent? The teaching methods. So this is an experimental study. Experimental study could be classified into two main categories: the true experimental and the quasi-experimental. What is meant by quasi? It is meant as if it is experimental, but it is not experimental. So we have the true experimental and the quasi, which means that as if it is experimental, but it is somehow experimental, but it is not true experimental. The experimental study usually called the randomized control studies. So randomized control studies are a study that randomly assign participant to an experimental group or to control group to test a specific intervention or to test the effect of the independent variable on the dependent variable. So we have a group, we classify them randomly into experimental group and control group in order to have no bias and to have a true experiment that give us a very perfect result. So randomized control study, we have experimental group, and then we do randomization, and then we have the control group, and we are measuring the change or no change that will happen in both groups. So randomized control study goes without any doubt. It is a prospective study. There is no randomized control study that can be retrospective. We have to do it in the future because we are going to do it today, and we are going to randomize, and we are going to test the effect of the independent on the dependent, etc. So the key of randomized control study is to do randomization. So there are conditions for randomized control study. Condition is to select the sample size that you are going to involve in your research. And this sample size, you have to know what is the sample size and how to define the control. Also, we have to know how to randomize. And if we are going to do any blinding, we have to know how to do blinding. We have to do selection to highlight the selection criteria, who will be included in the study and who will be excluded from the study. And there should be an ethical consideration for the randomized control studies. So how to sample? As we said before, we have the total population, which is the target population. And we have what is called the study population, and we have the sample population. So who is the total population? Let us say, for example, student in the medical school, all students in the medical school from year 1 to year 6 or from year 1 to year 5 are the target population. Okay? So we want to study the all students in medical schools all over the country. So study population are students of medical school, but in certain faculty. For example, Alexandria faculty or India faculty or Saudi Arabia faculty or whatever. And we cannot study all these students because they may be 10,000, for example. So we have to select sample of these students, which is a representative for the study population. So this is the population, this is the one, and this is the sample. What about this sample? This sample is representing the whole population? What do you think? I present this photo before in the residential session.
No.
Is this sample representing the population?
It is
No.
very small to represent the population.
And
It's not
all
representing.
of them, it's male, and there are some female, some kids.
Yes. So the population
not the
here.
same demographic.
Yes. So the population here, there are many males, females, young age, old age, whatever. They are coherent. They are heterogeneous group. So when we select the sample, we select them all adult males. So this sample is not representing the population. So to make it more representative, and this is called a non-probability sample. To make it more representative for the population, we have to select from them. Some of them males, some of them are females, some of them are young age, old age, whatever. So these are probability sample, which is representing the whole population. In order to do randomized control study, we have to do it as this one. Probability, we have to select a probability sample in order to have a good study. So the sample size, we have the sample, the origin of the sample, we have to define it before, and we have to highlight the sample size. The sample size, there are many ways to calculate the sample size. You can do it manual, which is very old way. You can do it electronic. You can do it by AI. You can do it by many ways to calculate the sample size. And we will talk about how to calculate the sample size in the next session, in the next week, inshallah. So what about randomization? We have many ways of randomization. So randomization is a process by which allocation of subjects or patient or participant to treatment group or to a test group, and this is not done by chance. It's actually done by many ways, either to do by the coin test or by dice rolling, and it is better to do by computer programs. There are many computer programs that can help you to do allocation, concealment, or randomization of your sample. It's very important also to have a good selection of the control. The control group should be comparable to the study group. Otherwise, you will be biased. So the control group should be comparable. As regards the blinding, we have many types of blinding, like open research or single blind or double blind or triple blind. There is not the scope to talk about them today, but in order to have a randomized control trial, we have to know what is placebo. Placebo is a medication, but it has no medicine. It is an inert, it contains an inert material, and we have to know also what is called a nocebo. Nocebo is a treatment like a placebo, but which is harmful. So we are not using any nocebo. We are having two groups, which is a control group, which is taking the placebo, and the study group, which is taking the medication. Anyway, example of randomized control study in education, this is one of the good examples. Use of simulator-based teaching to improve medical student knowledge and competencies. And this is a randomized control trial. What do you think? What was a researcher did to do this study like that?
Probably they took a group of medical students. They taught them simulation. They took them through simulation. And the other group, they just went through the traditional method of training.
Yes. So in this research, the researcher is having a class of, for example, 118 students. So in 118 students, he selected randomly, by any way, by computer, by whatever way, selected randomly a group of students, and he enrolled them in a simulator-based teaching in the skill lab. And the other students who are the control group, he just gives them some knowledge as usual, traditional way of teaching. After the end of the class, he tried to measure their knowledge attainment competencies and their knowledge and their skills. So this is a randomized control trial. He want to prove what? He want to prove is simulator-based teaching is helping for student acquisition of knowledge and skills better than the traditional way of teaching or not. So this is how this research was done. So this is the researcher, and he's an educator or teacher, and he's randomly selecting group of students, and then he recruits them, and he puts them in a class, and he tried to teach them with a problem-based method. And the other students who are traditional, who are the control group, he tried to teach them with the traditional teaching. And he tried after the end of the class to measure their academic performance or acquisition of knowledge or skills or whatever. So this is what is called the randomized control study in education. So now let us know what is the difference between the randomized control study and clinical trials. Anybody knows what are the clinical trials and what are the steps of clinical trials?
Clinical trial is, as it is indicated, is testing the efficacy of a new drug, usually.
Yes, right. So there is a difference between randomized control study and clinical trials. Let us highlight first clinical trials. What is clinical trials? If I want to test some medication on one disease, okay, and I want to know if this medication is efficient or not, okay. For example, this is a naive example. This is a placebo cream, and the other one, we have a cream which is extracted from, for example, the cactus. And we have patient with leg ulcer, varicose ulcer or whatever ulcer. So we have, for example, 100 patients with varicose ulcer. And randomly we selected 50 of them. We are going to treat them with the placebo cream. And the other 50 patients, we are going to treat them with the cream which is extracted from the cactus. What is the problem of this study?
There is an ethical concern.
Yes, it is an ethical concern. Yes, it is an ethical concern. So now, and this is another example, testing the efficacy of new vaccine versus placebo to prevent infection. We have an ethical concern. Or testing some certain disease, this disease group of people who are going to do surgical intervention, and the other group of people who are going to give medication. For example, if I'm having a patient with acute appendicitis, and I'm going to test if there is any medication that can cure acute appendicitis or make the inflammation subside, or I have to take them to surgery. So the problem of these investigations is the ethical point of view. That's why we have to know that the clinical trials, we cannot do it like that. Clinical trials, this is called clinical trials, which is trying something on patient. Clinical trials should pass into actually many steps. The first step, if I have medication, I have to test it first in the lab. And if I test it in the lab on animals or whatever, and it is safe, we can move to the next step, which is phase 0. Phase 0 means what? Means that we are going to test in adult, but with no disease. Okay? And here, how to test it in adult with no disease, why to test it in adult with no disease? And you should have a consent of that, and you should have a protocol for that, and there is a big ethical issue. You can have approval from the IRB, which is the Institutional Review Board or the Research Ethics Committee. We are testing the disease, the medication on old patients who have no disease to test the safety of this medication. If it is safe on these people, we have to move to phase 1. Phase 1 is to give a small dose of this medication to a group of people who are having the disease, and give also a small dose of this medication to another control group who are not having the disease. This is to test the efficacy of the medication. And here we are using what is called the randomized control study. So in order to know clinical trials, it should pass in all these phases. And the randomized control study is done in phase 1 and phase 2, in which phase 1 we are using small dosage of medication on group who are diseased, and group and another small dose of medication on another group who are control, and some of the diseased people are not given any medication.
And then we move to phase 2, who are giving more medication to some patients who are having the disease, and some patient and some control group, and not giving that to patients who are, it's very confusing, who are not having the disease, and this is called the randomized control study. So randomized control study trial is passing through all these phases. If you are passing to the final phase, is after the medication is in the market and they are observing them. If there is any problem, they will extract it again from the market. So there is a difference between randomized control study and clinical trials. Clinical trials, you cannot write clinical trials in medical education, because clinical trial mean that you are going to try new medication or new operation or something on patient. So if we are using randomized control, we say randomized control study. If you are going to use randomized control trial, you have to know that you are going to try something which is new. So this is the difference between randomized control study and randomized control trial. Don't mix between randomized control study and randomized control trial. Randomized control trial are not using in the medical field, but randomized control study, you can use it in the medical field, like those, the researcher who divide the student into 2 classes, one of them for simulation and the other without simulation. So this is what is called a true experimental design. So the randomized control study is part, our trial study is part of the randomized control trial. Don't be confused of that. So what about the quasi-experimental study? Quasi-experimental study, as we said, it is as if it is experimental. It is a research method that seeks to evaluate the causal relationship between variables, but without full control of the independent variable, which means without randomization. For example, let us give an example. This is a class which is studying with a problem-based learning, and the control class are studying with TPS learning, and we are comparing the acquisition of knowledge of the 2 classes. We didn't do any randomization. Those students are in their class, and the other students are in their class. They are convenient in their classes. This is a convenient sample, and we are comparing the acquisition of knowledge and skill among those 2 groups of students who are exposed to a different way of teaching method. So that's why it is called quasi, because we are not randomizing. And there are many types of quasi-experimental study. We are not going to talk about them today. And now we are going to wrap what we have said about the types of experimental study or observational study. So these are experimental study. We have the true experimental, which is randomized control study, or randomized control trial if we are going to try something on patient, and quasi-experimental study, you are not doing any randomization, and the observational are the descriptive part and the analytical part. So the major question here is which one is better? Actually, we have what is called the hierarchy of evidence. This pyramid, we put in it whatever the most prestigious research that we do. So at the base of the pyramid, we can find the case report and case series. They are very important, but they are at the base of the pyramid. Then followed by the case control study, and then the cohort study, and then the randomized control study. And randomized control study are considered the gold standard of the clinical research. And at the top of the pyramid, we have the systematic review and meta-analysis. So this is the level of evidence. This is the hierarchy of strengths of evidence, and you can find it like that. If you want your paper to be published in a very prestigious journal, it is better to do it in a randomized control study, a systematic review, and meta-analysis. Yet there are many journals who are very specific for the case report and case series. So any research is important. Systematic review is a type of comprehensive literature review. It has a system to do research. You are collecting different literature review, and you are reviewing them. And of course, you are extracting the good researches from, and you are avoiding or deleting the researches that are not unique or prestigious in this one, and then you are providing a complete and exhaustive summary of this literature. The meta-analysis is much bit difficult because you need to do statistical analysis, and it is of good statistical power because this research is at the top of the pyramid of hierarchy. These types of research, they are having steps to do it. They are difficult to be done, but they are very prestigious, and you can publish it in very prestigious journal. So to wrap up this part, we talked about the research design. One part of the research design, which is the quantitative research design. If you want to have a rest for 5 minutes, because we still have the qualitative research design and a mixed, they are only a limited number of slides. If you want to have a rest for 5 minutes, it's okay. If you want to continue, no problem. It's up to you.
Oh, please, if we
Rest,
can
please,
continue.
to pray.
I didn't get that.
Rest, please, to pray.
Rest, please. Okay. So now it is 8:45. We will reconvene at 8:50. It's okay. We still have 10 or maybe 20 minutes left. So we'll convene at 8:50. Is it okay with you?
8:50. It's 8:48 now.
Huh?
It's 8:48. We'll come back.
Okay. Oh, really? My
After
whole
2 minutes.
So
I think Maghrib is about 3. So
what-
at least we want 3 minutes.
so what is your suggestion?
It depends. If we have like 10 minutes left in the lecture, we can go, and we will have about 40 minutes till the next prayer. So we can do it. If we have
It's
more
up to
than
you, whatever you decide.
Okay, if it's 10 minutes left,
It's
we
10,
can
10:15, I'm
continue.
not sure. It's
Prof, please carry
Okay.
on.
Okay,
Yeah.
carry on.
Thank you.
So can you see the slides?
Yes, Prof.
Yes.
So,
Yeah.
so as we said, we have
Yes, we
the two
can.
major categories, the qualitative and quantitative, and we already talked about the difference between qualitative and quantitative. So in general, the qualitative research are, as we said, it is narration. It is observing people in their national environment, observing their interactions, their action, whatever they do. So we observe whatever they think, they feel, they see anything. And the qualitative research are very important in medical education. We have many types of qualitative research, like ethnography, which is in-depth studying of a particular culture, for example, or particular behavior, or in school, in home, in whatever. So ethnography, like exploring, for example, the impact of cultural belief and practice on management of certain disease in a specific community. People who are using the herbal, for example, if you are going to report that, this is called an ethnography. Or even if we are observing the student, how they manage, how they behave in the anatomy class, for example, this is called ethnography. So it is not necessary to be in an ethnic group of people. It can be in a school, or in a class, or if you are going to study the communication between students in a certain situation. So this is also called ethnography. The phenomenology is a very simple. It is like a phenomena. If you find a new phenomena and you want to highlight it and explain it, it is a phenomenology. And you can see the slide. This is a phenomena. Taking the selfie in any place, in any situation, in any time. So this is a phenomena. Using the mobile phone at any place or any situation, this is a phenomena. So if I am going to do a phenomenology research, for example, how does the extensive use of a mobile phone affect the student behavior? You can highlight that without any number. So this is called a phenomenology. Or another example, or how does the use of artificial intelligence in the behavior or in the attainment of knowledge of the undergraduate medical student? This is a phenomenon. All the undergraduate students now are using, sorry, what happened? Oh, it seems that somebody shared something. I don't know what happened.
Not me.
Okay. So is it clear now? Okay.
Yes.
So as regards the case study, it looks like the case study in the quantitative research. If we are going, for example, to study the effect of using the high fidelity simulator on the student satisfaction or behavior, so this is the case study. Or what is the effect of faculties attending faculty development program on their workplace when they go back to their workplace. This is also a case study. Grounded theory. Actually, when we are reporting the qualitative research, it's not necessary to write it. It is an ethnography. It is a grounded theory. It is not necessary to write it like that. You can write only it is a qualitative study. So it is very satisfactory to write that, because somebody feel very confusing to write. Is it a phenomenology? Is it an ethnography? It's very confusing. So if you write it a qualitative study, it's more than enough. The grounded theory is develop a theory from the data. So, for example, let us give an example to make it more simplified. Which type of formative assessment method that lead to acquisition of operative skills among surgical residents? For example, I don't know what is type of the formative assessment can I use, but I found when I am doing the research that, for example, the workplace-based assessment is the best one that helps them to acquire the knowledge or the operative skills. So this is the grounded theory. I have a data grounded from my research. I don't do the research and I have the idea what is the problem or what the solution, but I have the solution from the data, and that's why it is called the grounded theory. So the characteristic of the qualitative research that you have a small amount of participants. You don't need to have hundreds of participants. Sometimes they could be 15 participants or 20 participants. They are more than enough. Also, you usually use the open-ended data, and it is flexible, and actually it doesn't require any statistical analysis. It's just a narration, like telling a story. So the qualitative research can be used in the healthcare, for example, to explore the patient experience and perspective in health and illness. The researcher conducts an interview with the patient to ask them about what is their opinion about the healthcare service in one hospital, for example. So this can be a qualitative research. In the class, also we can do that. We can ask the student about their opinion about the teaching methods in general and what they like and what they dislike, etc. So this could be a qualitative research. So now we know what is qualitative research and what is quantitative research. And of course, as we said, we have mixed type of research. Mixing one qualitative type and one quantitative can be a mixed type of research. And of course, mixing the research, this way is called the triangulation. Why it is called triangulation? Because it is giving you the best result. If you are mixing one qualitative and one quantitative, it gives you a much better result. And triangulation means that attacking one target from different directions. That's why it is called triangulation. If we start with the qualitative, quantitative research, and then continue with the research, this is called explanatory sequential. But if we start with the qualitative and then continue with the quantitative, it's called exploratory sequential. And if we start with collecting both data at the same time, it's called convergent design. Again, we don't need to write these terms in your explaining your research. You can start with the qualitative or the quantitative or whatever type, and you don't need to write. If you write it, it's better to write it. But if you don't remember it and you don't want to write it, it's okay. You just mentioning that it is a mixed type of research is more than enough. So not to be confused about that. So example of that, if you have sequential or qual, investigating the impact of faculty development program on faculty needs and professional development, a mixed study. What are you going to do with that? You can start with the quantitative. So you have a survey and you distribute it among the participants to see their satisfaction level. But you don't know what satisfies their more. Are these the place of the training? Are the teachers? Are the material, scientific material? So you make a qualitative search, which is an interview, to ask them, what do you like best? So you are collecting the data of the qualitative and the quantitative in one research, and this is called the mixed type of research. So why mixed research is important? Because as we said, it helps you to have a good idea about the research idea that you have, and it helps you to attack the target or to explain your idea in many than one method. So mixed method, they are becoming very common now in educational research. I'm supervising many of the researches and projects and master thesis in my university, and we have almost all the researches and the project are mixed type of research because they are more prestigious and they are giving much better information. As we said, now we talked about the qualitative, quantitative, and mixed type of research. Which one is better and how to choose the methodology? It depends. Actually, it depends on your research method, on your research goal, on your expertise, your time, your fund, anything. So it will depend on whatever you want. So now to revise, we start by having a research idea, and then we formulate the research question, and then we choose the research design, and then we have to move to know what are the types of data that I'm going to carry on. If you are going to do experimental study, of course, you are going to use the data of the patient, either intervention, either doing a randomized control trial, whatever. But if you are going to do observation, you have to use the records, the observation, the interviews, the questionnaires, and the survey or questionnaire is one of the very important tools of collecting data for quantitative research. Once I say survey, it is equal to quantitative, because survey means that you are going to analyze it, you are going to make statistical analysis, so it is equal to quantitative research. In order to have a survey or a questionnaire, you can use any questionnaire that is present in any reference, and you have to use the reference, and you have to mention the reference. But you can also do your own questionnaire. And for doing your own questionnaire, you have to know what is the problem and what I'm going to do and what is my research question and what are the sample population and is there any studies previously have been done in this part or not, and what is the scale that I am going to use. I'm going to use agree, don't agree, strongly agree, etc. Or I am going to use to yes or no, or I'm going to use numbers or whatever. A survey is a very big issue, and we can explain it in one lecture by itself because it is a very important issue. And if you are interested, we can have a session about doing survey or questionnaire. And after finishing your survey or questionnaire, you have to validate it. And we have many ways of validation because you need to validate it to make it more prestigious or more eligible for using for your situation. So now for the qualitative research, we can use observation, as we said. We can use group discussion, we can use open-ended question, interviews, etc. And as we said, the group or the sample of the qualitative research are very small. So you can use observation, focus group discussion, anything. Focus group discussion is just recording or having the ideas or the point of view of the participant, and then you record it and you collect it in like that. This is the opinion of the participant, and then you categorize them for that, and then you can analyze them, but without any number. And actually, we can use the artificial intelligence to do that for you. It is called thematic analysis of the qualitative data. So now we talked about the research and the steps of doing research, and we know we had an idea about how to use artificial intelligence in using our research, and it helped us in having the study design, in doing questionnaire, because you can use one of the tool like Cascade in designing a questionnaire, whatever questionnaire you want. It can help you in data analysis. You can use any of these one to help you in that. And it can help you to revise your research question. And it can help you to write your manuscript or find a way to write a good manuscript. And this is our today's agenda. In the next time, inshallah, we are going to talk about the anatomy and physiology of writing a scientific paper, starting from the title, and then the introduction, material, method, and result, and discussion, and reference. We are going to highlight what are the tips and tricks of writing each part of these one. And we call it the anatomy and physiology of writing a scientific paper from all these aspects that you can see in the book. Thank you so much. If you have any question, please feel free to ask or comment.
Thank you very, very much, Prof. Yani, very interesting, very summarizing lecture. Thank you very, very much. Is the record is available for us?
Yes, I think Ms. Shaima will. She is recording already. I think she can.
She's recording, I know, but she will let it to us.
I will ask her. أستاذة شيماء الريكورد ممكن يبقى موجود؟
طبعا يا دكتور بنبعته على الموديل وبيترفع على اليوتيوب تشانل.
اوكي
شكرا جزيلا. شكرا.
Many thanks for your excellent lecture. Thank you very much.
Thank you so much for the efforts, dear professor.
Many thanks, Professor Amar. Many thanks.
Didn't get that. Is there any question?
Prof, if we need any help from you regarding the qualitative, can we email you the paper?
Yes, of course. Yes, of course. Delighted. Be delighted. No problem.
Can you please share your email ID? If you get your email ID.
Yes, I will send the email to Ms. Shaima, and she can.
Thank you. Thank you, Prof. Thank you, Prof.
I will send the email tomorrow, بإذن الله.
Okay.
Good night.
Thank you very much, Madam.
Thank you very much.
Thank you so much. Thanks so much. See you next week, inshallah.
Yeah, thank you.
Bye-bye.
Inshallah, thank you so much.
Inshallah, يعطيك العافية بروف.
Thank you so much.
جزاك الله خير.
Thanks, Prof.